Hi, this is Dr. Barron with High Point Spine and Joint Center, your Western Nebraska chiropractor. Again, this week we're kind of talking about tennis elbow or lateral epicondylitis, which is characterized by pain on the outside of the elbow. And so I just want to give you a little bit of a heads up of what we do in our office to examine and to treat this. So generally it's an overuse injury of these tendons and these ligaments on the outside of the elbow. And so we'll examine to see exactly which anatomical tissues are a problem. And so a lot of times we'll check the range of motion, so we'll see how far she can extend her elbow, how well she can flex it, as well as we want to check pronation and supination of the elbow and of the hand. The other thing we'll check is I want to see how these muscles react when they're under resistive stress. So I'll have her grip and see if that hurts her. A lot of times that will hurt people with tennis elbow. And if it doesn't, we can usually make it become exacerbated by trying to move while they resist me. A lot of times I'll have them lift their hand up, and if you just resist me, Avery, I'm going to pull down. That generally, if they have enough inflammation here, that generally will give them some pain there. And it'll just tell me exactly which tendons and which structures are inflamed. And so it gives me an idea there. Oftentimes, when we look at an elbow, a tennis elbow that's just not going away with some of the stretches we gave you and some of the other activities that you can do at home, we'll look at this elbow and check some of the joint mechanics. The radius is a bone that comes on the thumb side of the wrist. Here it goes all the way up to the elbow. And this radial head oftentimes can become fixated or restricted. And so adjusting that can get that to loosen up and take some pressure off of this elbow. So it's a good way to help with that. And it's just a nice, easy adjustment like that to get that radial head moving. We also will check the ulna and the ulnohumeral joint where it attaches in the back of the elbow here. Again, that can become fixated, and if it's not functioning correctly, we just get little adhesions and some fixations in the joint, and that can create some of this prolonged inflammation in that area. And so that's what that's like. And so generally, if we can do that and then do some of the stretching to keep that joint mobile, it will help to reduce some of the stress and some of the inflammation. So another treatment that we often do in the clinic for tennis elbow is dry needling. And so you can see here we've got some needles in Avery. These are just monofilament needles. They're not a gauge needle. And they're in some of these extensor muscles of the forearm. We've got one that's kind of threaded through to help relax all these extensor muscles. We've got a few over here for some of the lateral extensors, and then some that even come up from this lateral epicondyle up into her arm a little bit. And so what we use those needles for is we stick them through the muscle, and then that helps the muscle relax. Like when they went in, Avery can tell you, they kind of twitch just a little bit as that muscle depolarizes. And we're going to add a little bit of a current to those needles to try and get them just to fire so that then they relax and we can get them to settle down a little bit. So what I'll do is I'll put just a little bit of an electrical current through here. So you're going to turn this up. You'll feel this jump just a little bit, Avery. And you can kind of see that her muscle is twitching just a little bit. That's because of the current that we're putting through there. And again, we just do this for a few seconds and kind of let those muscles fire and then relax. And so this is very effective. Doing this a few times is very effective at getting these muscles to relax and fire. Another thing that we can sometimes do is we'll put ultrasound on here, but that again is using just sound waves to try and break up some scar tissue and adhesions in that muscle. I feel like the dry needling is more beneficial, but we can do both or have done both. So this is some of the things that we do in our office. This in conjunction with some rehabilitation and some exercises to try and keep those muscles loosened up is very effective at reducing this. Generally, this responds fairly quickly after 2 or 3 treatments of doing some dry needling to it. We see big improvements. There are certain very stubborn cases that are really chronic, sometimes that don't heal up. And so some of those, if they're bad enough, do require kind of a surgical intervention where they can clean out some of those tissues and get some of the inflammation out, and get some of the muscles repaired and healed up. But that's very rare and only in really severe cases. Generally, we can help with this pretty well. So if you have any questions, give us a call or let us know if you need